Welcome and thank you for joining us. My name is Ann Mounce and I'm the Senior Vice President and Managing Director for HRQ in Denver. We know many of our clients are joining us today, which is great to see. And for those of you who are not familiar with HRQ, we provide 3 integrated services across retained search and interim placement for human capital roles and enterprise-wide consulting with a focus on workforce planning and analytics, organizational design and effectiveness, HR transformation, and talent management and talent strategy, including compensation and total reward strategy. In 2018, HRQ was acquired by Landrum HR, a 50-year-old privately held company that extends our professional services to PEO, including payroll, benefits, workers' compensation, and HR services, as well as worksite management, a customized online labor solution for companies that use large numbers of temporary workers. You can find out more about all of our services on our websites, hrqinc.com and landrumhr.com. A couple of quick housekeeping items before we begin. We will be recording this webinar and it will be sent to everyone who has registered. Throughout the webinar, please ask questions using the question pane in the control panel. If we do not get to your question today, we will follow up with you individually via email to make sure all of your questions are answered. We are really excited about the topic for today of chartering a new course for employee behavioral health and wellness. After the enormous challenges faced in 2020 that are continuing into 2021, senior leaders are talking about the mental health and well-being needs of their employees at a level never seen before, and some for the very first time. As employees have faced incredible personal and professional struggles over the last year, leaders are starting to recognize that they need to broaden their view of managing the employee experience to managing the life experience of their employees. With that, it is my pleasure to introduce our 3 presenters for today, Brian Wilkerson, Julie Kopp, and Dr. Alicia Oliva. Brian Wilkerson is the Corporate Vice President of HRQ and is nationally recognized expert in the fields of talent strategy and workforce planning. For the past 20 years, Brian has been at the forefront of helping companies turn talent into a competitive advantage across multiple industries and within federal, state, and local government. As a thought leader in the field, Brian regularly speaks at national conferences and has authored countless articles, white papers, blogs, and book chapters on innovation and human capital. Julie Kopp is the VP of Product and Marketing at CirrusMD, where she leverages her 20 years of experience in product design and delivery, strategic planning and marketing, analysis and development to drive business growth. By continually building an understanding of the user, customer, and market needs, Julie fuels an alignment of vision and strategy throughout the organization. Dr. Alicia Oliva is the Psychiatry and Behavioral Health Medical Director with CirrusMD. With 15 years as a practicing psychiatrist, Dr. Oliva joined CirrusMD's provider network in 2020 as the medical director and lead psychiatrist to deliver care virtually to patients seeking behavioral health support and to lead the team in developing mental health solutions for a wide range of needs. Dr. Oliva is leading a new and innovative approach to integrated care to meet the evolving needs of employees and employers alike. With that, I'll pass it over to you, Brian, to kick us off.
Thanks, Ann. I appreciate it. I wanted to set some context before we dive into the focus on the topic today. And as Ann said, the pandemic has really changed the way we look at organizations, and it's very much challenged the traditional relationship between employee and employer. A lot of different elements to that. Just, obviously the work environment has changed quite a bit. When we look at now how we used to interact from a workplace perspective and what we have to do now based on our pandemic regulations and guidelines, it's very different. We've also seen changed interactions among managers, leaders, and employees. In many cases, people who might have seen each other on a daily basis or multiple times a week may not see each other for months at a time in many cases. And we're struggling in many cases to have those folks adjust to that new world of managing in a more virtual environment. Even essential businesses that have staff in person and are still working on site have to deal with new rules, new regulations, new ways of interacting, and that's challenging that employment relationship. We've also seen mandated changes in things like employee benefits, paid leave, sick time, how things are managed. I know, for example, many organizations have struggled with exposure to COVID and then the cycle of testing and waiting to see and then define quarantine periods, et cetera. And it's been very disruptive to how companies have to operate and manage their operations. We've also seen, and we'll talk a lot about this today, an increased expectation in terms of employees looking to their employers to really safeguard their health and safety. We've also seen a very urgent need to look at issues that are beyond sort of the traditional employment relationship and trying to deal with employee needs that are beyond what we've dealt with before. The need to manage quarantines, childcare and home learning, and the pressures that that puts on people. All of these things are changes that we've seen, and there's many more of them as we've all experienced. But all of these are having a significant impact on the workplace. Recent data shows that in the past 6 months, approximately 4 million people have left the workforce, and a large majority of those are women, 54% of them, as a matter of fact. And so as you look at that, many of those reasons are due to some of the challenges with childcare, access, expense, requirements around home learning, a lot of those different components. Another recent survey showed that 57% of the people who were surveyed would actually not go back to the workplace or would only go once a week if they were given their choice. A very different piece from what we've seen in the past in terms of people's desire to be, in a community, at work with other people, et cetera. Even when you look at productivity, the data that we see on productivity has been very mixed in terms of the impact of the pandemic on productivity. For example, some surveys have shown that companies who already had in place robust work from home or remote work or flexible work type of arrangements have generally fared, well, or even improved in some cases from a productivity perspective, while others have seen productivity decline as they've moved to a workplace and to a more virtual environment. In some cases, people who have seen initial productivity growth have started to see that decline as the pandemic has drug on, et cetera. When you look at some of the financial impacts, 10% of the working population is having trouble paying their mortgage or their rent, and nearly 14% are experiencing food shortages. Over 37% are experiencing trouble paying for basic household expenses that they didn't have trouble paying for prior to the pandemic. When you look then at some of the other issues that are surrounding it, employees are increasingly asking that companies take a stance on social justice issues, racial equity issues, et cetera. We're also seeing, the health and safety concerns coming to the forefront, both from an organized labor perspective and employees in general, driving organizations to do more to protect the health and safety and the wellness of their people. And finally, the prevalence of mental health issues is really rising significantly in organizations. A lot of information, even in the mainstream media, about this, and we're certainly going to dive into that in more depth. And I'm really pleased with the experts that we have here to talk through some of those things. I think you'll get a lot from that. Before we start and dive into some of the content, we actually wanted to poll you, the audience, and put up a survey question for you to answer briefly. And it's really talking about that behavioral health and wellness component. And the poll question is, as you think about employee behavioral health and wellness, what's top of mind? A, caring for the whole person. B, getting employees easy access to care. C, improving care quality. D, the cost of employee behavioral programs, or E, all of the above. So if you would take a minute and answer the poll question that's on your screen, and then we'll talk about the results here in a moment.
Great, and we have the poll results here, Brian. Caring for the whole person seems to be leading the pack of the top four with 21%, but 71% said all of the above.
Not surprising given what we've got going on today. This topic is certainly at the forefront. I know of a lot of the conversations that we have with senior executives at our clients. So to dive deeper into that, I'll turn it over to Julie.
Hello, everyone. Thank you for having me today. I'm excited to share with you some of the learnings that we've gained over the past year and how we see addressing this very important issue has really helped to make an impact in some profound ways. So what I want to do is really talk to you about what we set out to do last year. We really wanted to better understand the challenges and opportunities employers were facing in regards to supporting their employees. Our product focus at SiriusMD is to lead with the user experience and the customer experience, and we saw an opportunity and an unmet need that we wanted to explore and better understand. So we conducted many interviews with HR and benefits leaders from various industries as well as various size companies. Our goal was really to understand how HR leaders are approaching employee needs and taking care of employees beyond just healthcare. When COVID emerged, we also wanted to understand what impact the pandemic was having on approaches and programs to support employees in this new environment of uncertainty and constant change. Our findings aligned with what we were seeing across the healthcare industry in general, and I just want to walk through 8 of these key findings and insights. The first one is the importance of meeting employees where they are. This speaks to the physically, emotionally, and economically situations that employees are finding themselves in. And Brian touched on many of these. We heard from leaders the challenges of providing access to resources given the new environments employees found themselves in. In the healthcare industry, and particularly for behavioral health, this is of importance and really speaks to the challenges of people getting the care they need when they need it. The second insight was that we were seeing a strategic evolution of HR. As Brian also touched on this briefly in the sense that the pandemic seemed to be really driving the people and business strategy closer together as a key success to the business. And it was also really driving HR leadership into new areas that they were not necessarily trained for. The third area was around humanizing the workplace. And we heard from leaders how companies are thinking differently about how to show up for their employees. The fourth area, Brian also touched on, which was the diversity, equity, and inclusion as a key strategic focus. We also saw this as a key theme for healthcare as well. This increased awareness and focus on social determinants of health, disparities in the delivery and access to care, in addition to disparities at the point of care. The pandemic has put a greater spotlight on the impact that these disparities have across the population, as well as the impact to employers. The next area was how COVID has significantly changed how we think about safety. And we heard quite a bit about this, again, really extending beyond physical safety, and it challenged HR leaders to become experts in areas like safety that they may not have, again, that training or been prepared for. The sixth insight is around core values. This is a really interesting theme that really was a focus on the company's core values and how they continue to live them and show up with them with changing workplaces, uncertainty, and insecurities that the employees are feeling. The next area was on a focus of simplification, and certainly the challenges of the pandemic and moving to remote workforces, as well as just the changes to the physical locations for many people who had to still be at a physical location for their job, really with those increased safety protocols. And so this was really a way that they wanted to figure out how could we be easier to do businesses? What are the things that we need to do and to change? Finally, the last one is really around the stress and mental health beyond the walls of employment. This was a significant theme for the leaders that were being prioritized. Many people had those employees working remotely for the first time, as we just talked about, as well as those who had employees that had to be physically on the job with those increased safety protocols. Combined with this increased stress and challenges that came with managing the home learning for children, keeping families healthy, focusing on quarantine, these became significant concerns as HR leaders balanced taking care of their employees and continuing to support running the business. So with these learnings, we wanted to better understand the data, particularly regarding behavioral and mental health. So the next slide shows us that this research here and the data here is from a study actually in 2019. So you can imagine if we actually ran this in 2020, the difference that we might see. In fact, it might be even more exacerbated. And what we see here is that there are over 5 million adults in the US with a behavioral health condition. And the research shows that 70% did not receive care. There are over 18 million adults with substance abuse conditions, and 92% go untreated. And finally, over the 35 million with mental illness, only 65% were untreated. So when we look at the number of Americans with behavioral, mental health, or substance abuse conditions, the total number of people affected by mental illness and the issues around those not receiving care, we really wanted to understand why they are not receiving care and what can be done to provide a better delivery method of care. So there's 4 areas that are barriers to behavioral health care, and I would say many of these also align with barriers to getting, just generic health care. So the majority of people don't seek care because of significant barriers that include the stigma associated with having mental health challenges, the access to quality care, the cost of care, and navigation to quality care. So let's start with the stigma. The stigma, as the previous slide showed us, the actual numbers. What we see is that patients are often uncomfortable pursuing mental health services. They often choose to live with the issues they have rather than seeking treatment. The stigma of behavioral health services remains a reality in our culture, although we've seen that there's been many efforts made to reduce the stigma, make it more publicly comfortable for people to talk about. But the pandemic made the stigma even more profound as the stress and uncertainty made it more difficult to ask for help. Access to care is a significant barrier. This is true for all health care, particularly for those that are affected by the disparities in our care delivery system, as we talked about before. There's a shortage of mental health providers, specifically psychiatrists, as well as therapists across the country. And we know that psychiatrists in particular tend to cluster in urban areas, and that it's hard to find resources in rural areas or smaller communities. But even when there are behavioral health specialists available, it is often 30 to 90 days before someone could get an appointment. I'm going to skip over to navigation and talk about the navigation of services in the healthcare system. And that continues to be a significant challenge in receiving care. So many of the solutions are siloed solutions and aren't really connected together for the user. And as someone who's very focused on that user experience, that importance that we place on the continuity of care and integration of care is so critical, particularly in the context of behavioral health. And so today, it's really difficult for patients experiencing behavioral health issues to find the right resources at the right time, on their time, especially if they're trying to find care within their health plan network and with the challenges of work schedules and family demands. And certainly it's even been more challenging given COVID. The healthcare industry has made it pretty difficult to navigate these resources, and it can be confusing to know who to go to, if it is a covered benefit, and if it is a limited benefit, and how long they'll be able to use it. So finally, the cost, and this is a pretty significant barrier to behavioral health care. And as Brian pointed out in those data, that cost is pretty significant when they're already dealing with the inability to meet some of their basic needs. And so this is often cited as a significant barrier because, really a person's health journey, and there's a greater need in a person's health journey, there's that greater need of continuity of care as I talked about. Well, behavioral health is a journey that requires an investment, not only in time, but in cost, that is often the most significant barrier to overcome for these people. This cost impacts both employers and employees. And so we can see here from these statistics that the cost of care and the cost of not receiving care impacts both sides of the equation. So we set out to bridge the gap and provide barrier-free access to care that supports the patient where they are, addresses their physical conditions and their behavioral health issues, while ensuring they are supported in navigating the care they need. So what we've seen in our own experience that when we make it easy to access care, we make it affordable and free in many cases, and we help navigate the patient through the journey, we see not only positive clinical outcomes, of profound outcomes for the ability of an employee to be more engaged, better able to be present in work. And we've actually seen some pretty amazing testimonials of the loyalty and appreciation of their employers for providing this kind of benefit and this resource to them. So the modality actually matters as well. And a chat-first solution greatly reduced the stigma, and it allows the individual to feel more open and trusting in sharing their concerns. So I want to pass it over to Dr. Oliva, who's going to walk us through and talk about what she's seen from the front lines of delivering care in this way and the impact that she's seen.
Thank you, Julie. And make sure that everybody can hear me okay. Sounds like it. Okay. So as Julie said, I'm Dr. Oliva. Thanks again for having me today and for coming to listen. Next slide. As Julie discussed already, there are several barriers to engaging in mental health treatment. As she mentioned, these barriers have only been further exacerbated during COVID-19 due to the markedly increased consumer demand for care across the country. There were pre-existing supply issues of not having enough mental health care professionals prior to COVID-19, and this supply-demand gap has just further increased since the start of the pandemic. Thus, much of the care responsibility for these patients has fallen on primary care physicians and those providers to fill this gap, who are often not fully trained, don't have the resources, and are not completely comfortable with treating these conditions. The National Institute for Mental Health actually had a statistic that 75% of adult patients with depression will go to see their primary care providers, but only half of them will be accurately diagnosed with a depression disorder. On the platform in which I work, we have seen, for instance, that patients may come on to speak with us about a primary physical concern. And as we really get more into what's going on with them, it becomes apparent that the underlying issue is really related to a mental health condition. Next slide. Throughout 2020, as with other care delivery systems, we've seen an increased demand for mental health services. We are seeing many people reaching out for the very first time ever to address both new and chronic mental health concerns, sometimes sitting on these concerns for years and telling us that they're reaching out for the very first time. Predominantly, we've seen a rise in anxiety, depression, sleep disorders, as well as mood disorders and adjustment disorders to the current circumstances that have been occurring throughout 2020 and 2021. In fact, we saw a 300% average increase in patients seeking mental health care throughout 2020, and we anticipate that these numbers will remain high in the next year as well. Next slide. So what have we learned from what we have seen in 2020 that we can share with you today? As I mentioned earlier, the demand for mental health services has increased significantly, specifically around anxiety and depression, as well as a variety of other mental health conditions, as I mentioned. In my work on our platform, I've also seen increased concerns for substance use disorders and addiction issues. And unfortunately, there has been an increased incidence of domestic violence and child abuse reports across the country as well. As we know, many women are not able to leave their home due to the pandemic and are stuck with their abusers. And we also know that the increased stress and burden that's being put on parents is unfortunately sometimes taken out on the children. And we know that due to these ongoing stressors and uncertainty of our current times, many of these symptoms are not going to improve without intervention. And we know that the earlier people can reach out and receive that care, the better. So how can you help as employers? I think it's really important for employers to understand that their employees are dealing with, or may be dealing with, much more than appears on the surface. We're all trying to figure out how to work in various new environments today, which are not always stress-free, and sometimes come complete with homeschooling children or barking dogs while on our meetings. Or some people are dealing with the fear and uncertainty of being an essential worker or a frontline worker and uncertain of how to protect themselves from getting COVID-19 or simply from becoming burnt out. I think it's important for our employers to be able to figure out how to get their employees assistance with solutions that help meet them where they are and with the ease of access with providers they can trust, not just during this current time period in 2021 in this pandemic, but beyond. Next slide. So how do we propose doing this effectively? So first, you need to facilitate breaking down barriers to care and increasing access to mental health. To give you a little bit more background about me, I'm an adult psychiatrist by training who's currently working as a psychiatric medical director for my current company to help build and develop a behavioral health solution. And I'm also a provider on our platform. We are in an environment that is chat first. And I bring this up because I believe that chat offers a unique opportunity to break through care barriers in that it offers an asynchronous conversation if needed and offers more privacy than, say, a phone or video where sometimes conversations can be overheard. By shifting away from in-person appointments and waiting for videos to spin up where people are on the doctor's schedule, a move to chat allows for patients' needs to be met on their schedule. So, for example, I might be chatting with somebody in the morning and they're getting ready for work, and they tell me they need to leave to go to work, but let me know they're going to have a break later that morning, and they ask if they can resume that chat, and we can finish up the appointment then, and we can absolutely do that. So if we're able to break down barriers and make it easier to receive care, people are going to follow up and engage in their care. As already mentioned, it's really important to have good access to mental health solutions and to help build safety nets, which help provide not just early identification of issues and treating those issues and concerns sooner, but the hope is that people don't have to fall so far into severe range symptoms that it causes increased absenteeism from work or functional impairments. It is important for people to have trust in the providers and physicians they're seeking help from. I have found it really interesting compared to my 10 years or so in practice in brick and mortar psychiatry that people are incredibly forthcoming on chat because they don't have to look me in the eye, and they seem to be less embarrassed about the issues that they're concerned about. And I think that this is really unique through the nature of care through chat first services. And we've seen that while it's really important for people to be able to feel comfortable talking with us about a variety of issues, that also knowing we're going to follow up with them or that we're there if they need anything is vital to the trust of that relationship. And again, it's important for employers to help find solutions to meet their employees where they are with care anytime and anywhere. Next slide. So what's working? So in summary, for my part here, it's important to ensure that your programs facilitate building employee confidence that helps make your employees happier, healthier, and more engaged. And to do this by, one, focusing on caring for the whole person and always keeping them at the center of the care being delivered. Two, building trust and relationships with people by being available, making commitments to check back in on them when appropriate, and by providing high-quality physician-directed care. We often hear that people say they're not certain what might be going on with them and they're not certain where to seek care. It has been my experience that having models of care that are integrated helps facilitate that whole person care and allows the patient to receive the right physician-directed care. This really allows the person to come on and say, hey, I'm here, here's what's going on, and I have no idea what to do or what this is. And then they can work collaboratively with their doctor to figure out what those next best steps are, which might not always be the emergency room or urgent care. Through a model that further integrates mental health services, people can seamlessly transfer from medical providers to mental health providers and vice versa as needed. So again, it's critical to make sure you have high quality providers and physicians ideally working together in an integrated care system. And finally, I'll leave you with this. You might be wondering, can my employees really get good care through virtual healthcare solutions? My answer is absolutely yes. In my experience with the right providers and care solutions directed towards caring for the whole patient, meeting people where they are when they need it, providing high quality evidence-based care, and creating a trusting relationship, this can absolutely occur. I am happy to answer any questions later, but for now, I'm going to pass it over to Brian, and he can talk more about how to think differently about strategies to improve your approach to your employee programs.
Thanks, and thanks to both of you for the insight on this, which I think is really one of the critical issues of today, and something that all organizations really need to be thinking about and how to address. I'm going to talk a little bit more about how we take some of these learnings and integrate it into HR programs and some broader strategic level considerations around these pieces. First, as we look at where we are from a post-pandemic, and we're not quite post-pandemic yet, but certainly as we're starting to evolve into that post-pandemic workplace, there are a number of really key considerations for every company. One, looking at the relationships that they have with the employees, and that's kind of the whole premise that we started this webinar on. But looking at things like employment brand, value proposition, and then relationships between talent and the organization. That's where I'm going to spend most of my time really talking for the rest of this. But I wanted to mention briefly a few others that tie in. One is really thinking about skills and reskilling the organization. I mentioned earlier some of the challenges that managers and leaders are having in terms of working in this current environment, and how do we really reskill them to better be able to work in the conditions that we've got now, but also what skills are required for employees to be able to be successful in the future. Thinking about your organization structure and reorganization, how do you make your organization more resilient, more agile, is another key consideration. And then finally, reshoring, or thinking about your supplier relationships and what those look like. I'm not going to spend too much time on that, but I do want to dive deeper into what we've talked about today and its implications for relationships between employees and employers, and then how that translates into HR programs. From a relationship perspective, one of the most critical things that we can do now is really redefine our employment brand and our employee value proposition. What does it mean to work here? Why work here versus someplace else? What are we all about as an organization? The pandemic has really forced organizations to make a lot of decisions and take stances on a number of things, right? From how we deal with issues of health and wellness, social equity, racial justice, all of those different pieces. And all of our companies have changed, whether we're fully aware of what those changes are or not, just by the nature of how we've changed the work environment, how we've changed how people have interacted. Companies have changed, and we have to update our employment brand and our employee value proposition to reflect that. So there's some really key components of the brand and value proposition that you should be thinking about. One is, what are our values in the organization, and what do we represent in terms of values? Have those changed? Are they the same? Have they shifted at all? Where do we stand on key issues that are out in the world today, whether it's diversity or equity, inclusion, social justice, et cetera? More important, how do we really look at the key parameters of our relationship with our employees? How are we looking at some of the whole person issues that were raised earlier? How are we looking at sort of care for people inside and outside of work? Or where are we going to define those boundaries? Where are we going to define the areas that we're going to address as an employer and not? What employees should expect from our work environment and what that's going to look like going forward is really important. What does engagement really mean in this new world of work, right? So we think about engagement and participation and things like that, and that may have been a lot easier to measure or visually see or understand when we had everybody working in person, but when everybody has masks on and we're socially distant or remote, can we really tell, and is it the same going forward? So what do we expect in terms of engagement, and what does that look like? And a very important one is around accountability. What do we expect from our employees in terms of accountability? How do we equip our managers to hold people accountable? What do we expect in terms of productivity, et cetera? All of these are really key questions that we should be asking ourselves right now, and thinking about how does that translate into what our employment brand and our employee value proposition is for the future. And just to briefly differentiate between those, the employment brand is more of that sort of, marketing and sort of communication statement that we have about who we are and what we're all about, where employee value proposition is really that trade-off between employees and the employer. What do you get for working here? What do we expect from you in terms of those benefits, et cetera? So it's important to rethink both of those and really redefine both of those in the world that we're in today. When you're thinking about employment brand, there's some key principles to keep in mind in terms of how you really articulate that. And many of these sort of are similar to principles that you might think about in terms of marketing. But it's really important the brand's clear and consistent. You should use it as a way to drive behavior and use it as guideposts for the decision. In other words, people should be able to refer back to who you are as an employer when they're trying to think about how should they interact with employees, how should they make HR personnel decisions, et cetera. The more closely that your employment brand mirrors your customer brand, the easier it is for managers and employees to really align on that and deliver. What do I mean by that? Let's say, for example, that your customer brand revolves around making it easy for the customer to do business with you. Well, if on the internal front, it's not so much easy to do business with you and you have very antiquated processes and it's very difficult for employees to get what they need, then it makes it more difficult for them to really align and sort of believe in that employment brand. Even when you're thinking about rewards, they should really align with that brand and with living that brand. And it's important to make sure that as you're looking at this, that it's a joint effort between, HR, marketing, communications, operations, that everybody is really aligned on what the brand is and how it's going to be delivered, what it looks like, and that you're rewarding those behaviors accordingly. When you look at brand and delivering on brand, it's about promise and delivery. What are you promising through the brand, and what are you really delivering in your operations and the way that you're working, and making sure that those things are aligned. It's also important, the companies that are best at really living brand and driving brand align sort of everything around them. So, internal sites, communications, all of those things really align to the employment brand and reinforce that employment brand. It's not something that just gets, put out a couple of times a year versus broad employee meetings or things of that nature. It's really something that is front and center all the time. It's also important, especially in these times, to really look at what we call, ghosts and legends in an organization. Are there things in your past that maybe are contrary to your employment brand or what you want to be from an employment brand perspective? And talk about how are we changing? How is it that we're going to actually be different and we're going to live up to the employment brand that we've put out there? That becomes particularly important in times like the pandemic. Many organizations were caught off guard by, some of the requirements that they had to put in place, some of the actions that they had to take to maintain themselves in terms of being financially viable. Might have been reductions in force or different kinds of furloughs or things of that nature that may have not have set very well with employees. Being honest about, where there are places where the company could have gone better, could have done things better. How have you lived your brand or not lived your brand? What are you going to do going forward? All those are really important as you're resetting the expectations around employment brand with your employees, and communicating about those is really critical. So that first step of redefining employment brand and employment value proposition are really important. And then related to that, there's a number of other things that the organization should do to kind of reinforce that. I talked about reskilling a little bit earlier, and I want to mention the things that are sort of particularly relevant to, moving into the post-pandemic world. First of all, those leaders and managers and the new skills for those folks. When you look at that, there's a number of different skills that they really need to be concerned about. How do they manage a connected, distributed, and diverse workforce? How do they really ensure accountability and productivity without being able to see people and walk around and see if they're at their desk or what they're doing or things of that nature? How do they manage with new technology, collaboration technology, all these different components that we're now much more used to? And how do they deal with new concerns around diversity and equity and inclusion, mental health, the whole person, et cetera? This sort of block of skills alone is a really critical component for organizations to be thinking through. How do we sort of help people unlearn what they've known in the past about management and how it's going to work that's not relevant anymore, and learn the new skills, the new tools that it's going to take in order for them to be successful? Similarly, we have to think about what skills employees need to be successful in your company's future. That flows from the brand, but it also looks at what your operations are going to look like. So how do we look at things like the virtual environment? How permanent is that in our world? What's the future of work going to look like in terms of hybrid teams or virtual teams versus in-person, et cetera? What new technology are they going to have to be able to use? Not just collaboration, but one of the things that many companies have seen is really a need for more in the way of knowledge management, increasing use of artificial intelligence to take away some of the dependence on people to do certain processes, et cetera. How can you collaborate and innovate effectively in the environments that we're in now? It's not like I can walk down the hallway and sort of have a chat with somebody about this great new idea that I have in terms of that. We tend to be more scheduled, more formal in terms of our interaction with folks, and what does that look like in terms of that? How then do we not only sort of create the resources for employees to manage their mental health, manage their wellness, but how do we also, give them the skills? We talked earlier about some of the barriers to care. We talked about things like stigma. We talked about things like navigating the systems. How do we really build people's knowledge and skills to manage through some of those issues and be able to access the resources that we're trying to provide them in order to get the help or the support that they need? And in the area of diversity and equity and inclusion, how do we manage in an environment that's more diverse, but also how do we capitalize on diversity? How do we really make it an organizational strength? Similarly, for the organization, similar kinds of competencies in terms of what we need to be able to do for the future. Managing critical and difficult conversations is a really critical one as well. Some organizations, folks aren't necessarily that great at it when, we have people in person, and, does the virtual environment help us or hurt us in that respect? It's really important too that we build the agility and resilience of the organization and help our employees be more comfortable with ambiguity, because as much as we might be on a good trajectory in terms of starting to get vaccines and things like that out, there's still a lot of uncertainty, both from an economic perspective and a public health perspective, that we're going to continue to deal with. There's going to be more curveballs. There's going to be more things that we're going to have to work through with our employees and have to help them deal with. And so how do we really build those components? So as you're thinking about, what you want to be for the future, the next step is to really think about what skills is it going to take in order for your employees to get there and help build the environment that you need in order to be successful. As you think about then breaking that down to what else do you have to do? Well, the next thing you really have to think about is, how do I make sure that I've got the right talent supply? So as I redefine who I am from a brand perspective, some people will like that and some people won't. Some people will decide that, maybe they want a different environment. And we're already seeing in some of the data that we've been looking at for the past few months, the number of people who are leaving jobs voluntarily is actually getting higher in organizations. And one of the reasons cited is the organization isn't aligned anymore with where they want to be or what they want to do. And so it's important, once you kind of redefine who you want to be and think about the skills, that you can secure the right talent for the future. I'm not going to spend too much time on this, but just recognize that it's important for you to be able to both predict the things that you need from a talent perspective and then deliver on those. So having the right analytics, having the right predictive analytics to be able to tell what are our staffing needs going to be given the uncertainty that we're facing. How do we find ways to rapidly bring on talent to make sure that we've got the right supply for the key roles that we always need to have? How are we out there in the market understanding what talent is available and where we're going to get it from when we need it? But also looking at your internal talent supply and saying, where do we have risks? Where do we have potential for people to leave the organization because of, changes in the work environment, because of challenges that they may be dealing with either personally or in their home environment? And how do we rapidly respond to that to really help mitigate some of those risks? How do we bring the resources that we have to bear in order to be able to do that? We have to think about what sort of long-term hold do we have on people? And what do I mean by that? Why would people want to stay in our work environment long-term? Why would they want to be sort of a long-term employee of our organization? People generally lean towards compensation when you look at that, but there's much more to it than that. How well does it align from a culture perspective, from their ambitions in terms of where they want to be, the kind of flexibility that they need to, deal with their environment outside of work, et cetera, and how well aligned are we on that? and making sure that we're building the right tools to assess and manage performance. I think that's one of the things that has become increasingly difficult in this post-pandemic world. And how do we make sure that we've got the right things in place to hold people accountable, to build their performance, to build their skills over time, and to make sure that we're getting what we need in terms of that. So securing that talent supply is also a really critical action. I want to talk then a little bit about kind of a different lens on how we evaluate HR programs, meaning when we're thinking about things that we should put into place, what kinds of considerations should we be looking at? So these are some of the critical elements, and they tie back to all the things that we've been talking about through this. When we're evaluating HR programs or people programs, there's a number of questions that we should be asking ourselves. Number one, how do they really build the agility and resilience of the organization? How do they help us become better able to deal with changes in the environment, rapidly changing environment, uncertainty, all of those things? How well do they align with the value proposition and the brand that we're trying to build? Do these programs really take that whole person perspective, and how do they help us address the needs of the whole person in the workplace? And then we need to also start thinking about our workforce more as individuals and as segments, as opposed to one sort of monolithic group. So in the past, we've had a lot of focus on sort of consistency and creating consistent programs and those kinds of things. And I would argue that it's more important than ever to really being able to tailor individualized programs and benefits to the needs of the employees that you have. And I think having part of that be that wellness and that mental health component is absolutely critical as well. Diversity, equity, and inclusion, you hear that theme over and over again. It's not something that's going away in terms of organizations, and it is something that we have to really be use as part of the lenses that we evaluate our HR programs on. And finally, are we getting a differentiated return on investment? What do I mean by that? Well, there's a certain amount that we have to spend in order to just, kind of be on parity from a marketplace perspective. We have to have competitive comp, we have to have competitive benefits, we have to have the basics in terms of training. But then there's a lot of discretionary investments that we make from a human capital perspective. Are those discretionary investments actually getting us a return? And are we measuring that? And are we making sure that that return is worth it to the organization? Because especially in these times, everybody has scarce resources. So we have to make sure that we're using those wisely. So this is a different set of lenses or different set of considerations when thinking about people programs that really come directly out of the environment that we're in today. Lastly, a different way to think about retention management and that relationship with employees. It's really thinking about it in terms of a two-way value proposition. What does the company want and expect from you, and what do you want and expect from the company? That is one of those conceptually simple but difficult to implement kind of things. So if you think about how this works in practice, ultimately what you want to do is you want to drive performance, you want to drive engagement, you want to drive retention. You want both the company and the employee to be getting what they want out of the relationship. But to do that, you really have to make sure that your managers are skilled in sort of critical conversations, and they can have, the right conversations with employees to talk about when this equation is out of balance, assess what employees really need, or that sort of thing. It's not a situation where, the manager comes to the employee and says, well, I really wanted to give you more of a raise, but HR would only let me give you 3%. That's not the conversation that we're talking about here. It's understanding what is it the employee values, what do they want out of the relationship, and how can the company actually deliver on that. And on the flip side, how can the company actually sort of tailor what they want, and how do I have the hard conversations about performance, about skills, about the things that the company needs from you. So creating that two-way dialogue, managing that two-way value proposition is really a critical element. And it's a different way of thinking than we work today. It's not managers going into the break room and saying, so are you thinking about quitting? But it's really being able to think more and work more and understand more about drivers of behavior, drivers of retention, et cetera, and being able to manage those more on a daily basis. So a lot to that, but It flows out of the value proposition, it flows out of the employment brand, and it's really a different way to think about how we keep productivity and retention in balance. To wrap up, from a post-pandemic perspective, there's a number of things that are required, right? One, really rethinking that employment brand and relationship with your employees. And part of rethinking that has to be, how do I have genuine care for the employees, for their health, for their safety, and their wellness? And that really requires relooking at the concept of whole self in the workplace. How do we manage and provide resources for the employees themselves, as well as managers and leaders in the organization to, better integrate the whole self into work, and how do we manage that piece? And we really need to make sure that we have leaders and managers who can deliver on the company's promises and the infrastructure to support them in order to do that. All of these things are part of this sort of spherical picture that really says, here's how we're going to be able to get the right talent, keep the right talent, and engage them, and make sure that they're productive going forward. With that, we'll open it up to questions.
Thank you, Brian. That was great. We've got some good questions here. And I think the first one goes to you, Dr. Oliva, is have you seen anything particularly surprising about behavioral health needs this past year?
Thank you. Hold on just a second. Just making sure my audio is right so everybody can hear me.
Yes.
I think that what has been most surprising is the increase of substance use disorders that I have seen in a much younger population. As a psychiatrist, anxiety and depression are kind of my bread and butter, sleep disorders and all of that. Substance use disorders like alcoholism, though, I would say are significantly higher than I would have anticipated, and the severity of those are much higher. I was giving an example the other day of a few young patients in their 20s who I've been following for depression and anxiety, who were really starting around the 15 to 18 drink per night mark. And these are, young 20-somethings who otherwise seemingly are functioning or functional at work, but really are not doing well. And how do you manage the boredom, the being cooped up because of the pandemic and there's nothing else to do but to come home from work and drink and watch TV or movies? And then that becomes a problem, which then secondarily feeds that depression and that anxiety further, because alcohol is a depressant. So I think that is probably the thing that's been the most surprising to me is the severity and the kind of the volume of alcohol that has really been out there pre-pandemic.
Wow. Yeah, that is very surprising and leads to their need for greater level of support this year. And then next question touches on that. I'll address this to you, Julie. In looking at user experience, is there something specific users of virtual care are asking for?
Yeah, it's a great question. What we found is that what people appreciate the most is that instant on-demand access to care. They're also really looking for the trust component that Dr. Oliva even talked about, and making sure that when they're getting referred somewhere, that it's within their network and that it's affordable. And so that easy access is a theme that we've heard over and over and over again, not just from people who use the platform, but even to HR leaders. And we've talked to many people who have, employees that are in an office or working from home, but also people in distribution centers, on the road, in transportation, out in the field working, and getting them that access to care is of paramount importance, because often these people will live in areas that we sort of referenced around, the social disparities of health. They live in health deserts, transportation deserts, and that access to care, particularly at COVID, really exacerbated, their need to have better, easier, barrier-free access to care.
Thank you. Yep. And Brian, this question I'll direct to you. As businesses are starting to build an employment brand, who are the key stakeholders that should be included? And really the second part of that question is then how do you measure the program's success?
So on the first part of the question, engagement and what that looks like, I think that you really need, from a sponsorship perspective, involvement from the executive, the operations, HR, marketing, communications, all of them sort of have to be involved in that overall sponsorship of the initiative. But in terms of really defining the brand and driving that, it's also important to get a good cross-section of the organization involved in those conversations. So managers who are going to have to deliver on the brand, employees who are going to have to find the brand attractive. In some cases, you may want to involve external stakeholders like suppliers or customers as well, but that's very dependent on your culture and what you want to try to do. But having that broad section of employees and managers involved is really important. I think on the second piece, in terms of measurements, there's a couple of really key benefits and things that you want to measure. So one, is the brand being recognized? And, you can look at things like candidate surveys and things of that nature to see how well they have seen and understand your brand and how that message resonates with them. I also find it useful to measure 3 to 6 months once a new employee joins, what they heard and what they understood about the brand before they came in, as well as sort of what some of their perceptions are of it now. And then I think the other place to measure is really how that brand and brand delivery is impacting retention and engagement in the organization. And that can be done through a number of surveys and pulse surveys and things of that nature to try to get at that information, or even focus groups to do that. But essentially you want the brand to get you the talent you want, and then you want it to help you engage and retain that talent as well. So those are the areas that I would be focused on in terms of measuring.
Thank you. And another one, gosh, there's so many good ones here. I think another one is, and I'll open this up because I think all three of you have some ideas around this, but what are some ways or tools that employers can give to their employees to get over the stigma of mental health and accessing mental health support?
So I'll start. This is Julie. Number one is awareness, and I see there's also a question about something similar to this in the questions. So oftentimes employees don't have the awareness that these resources are available to them. So continually making sure you're communicating that they have the resource, and then making sure there's not barriers. What we found in our research and why we went barrier-free is because some of those barriers, like even just scheduling an appointment, are really difficult for employees. Particularly, we have retail employees that don't have time to make an appointment or can't get an appointment when they're on a break or when they're not working or after hours. And so, being able to have something that's really accessible is really important. And so, I would look at why aren't they accessing those resources, because there are some great resources, but often there are barriers that we don't realize are barriers for care. And I think too, just making sure to do everything you can to eliminate the stigma. Many times people feel like they can't talk about their mental health because they don't want to lose their jobs, or that might jeopardize their ability to, in their workplace. And so we want to make sure that it's private, that they feel, supported. And I think that's something we see a lot, is that, even just offering simple resources like this goes a long way for people to feel like that their employers are, really supporting them.
Yeah, I think that. Oh yeah, go ahead, Brian.
I just want to add, because this is an area that I'm very passionate about. I think that we have to be more honest in the workplace about, people who have encountered and overcome and really sort of had to work through some of these issues. And the fact that, they can be overcome and they can, be dealt with in that. And I think that, it takes a lot of strength to be able to admit that. But it's very powerful for people who are experiencing those things to be able to see others who have worked through it and who are willing to share those experiences. And so I think that's another way that we can help reduce some of that stigma.
Hmm. Yeah, absolutely. There's a lot more emphasis on the managers to be a little more vulnerable and share, a kind of as a model, and engage, to Julie's point, really raising awareness in the organization and creating that conversation around mental health. And there are a few questions we didn't get to, but again, we will follow up with with you individually to ensure that each of your questions are answered. So on behalf of HRQ, Landrum HR, and Cirrus MD, thank you for joining us today.